A breast cancer nurse navigator is a nurse. We do registered nurse here. We are here from the time they get diagnosed. Usually they have a biopsy, it's positive for cancer, and then I reach out to them and I make sure they understand what does that pathology mean. Do they have an appointment for a surgeon? Get them set up for assessment from the doctor. And then I'm here for education. I provide education on procedures, maybe imaging, make sure that they're compliant with their appointment times and they know where to go. And then I look to see what are their needs. I look at, are there any supportive needs they need, such as support groups or oncology supportive counselors, which we have here at Johnston-Willis. Do they need online support systems because of their job? I help arrange that. I advocate for them. I go from, if they have any needs, to being that voice for them. When you're a navigator, you're there from beginning to each of the treatment doctors. So with breast cancer, you go from surgery, maybe chemotherapy, and then radiation. And I'm that one person that walks them through all of it. So if they have a question or they have a concern, I can advocate for them. But probably the biggest part of my job is to remove barriers to care. And there are a lot of barriers to care, I think, for all of us. But when you have cancer, it's very overwhelming sometimes to already have such needs based on your financial needs, or maybe there's some social needs in your life. So probably my biggest barrier that I do is try to help find financial assistance for them. Sometimes transportations, but just basically find out what is preventing them from being able to have their treatments and see if we can find a way of going around it. What other resources can I find for those patients?